Every year, 150,000 people die from lack of first aid, and they're not big injuries, they're not big head injuries or anything that would, yeah. They're just things like choking or having trouble with breathing that you could help out with if you learned how to do first aid. So the definition for first aid is on page 633 of Dorland's Medical Dictionary, and it states emergency care and treatment of an injured or ill person before medical and surgical management can be secured. And if you were babysitting and one of the kids were choking or something, would you frantically call 911 and wait for the ambulance to show up? 2, try to do something without knowing how. Or 3, know how to do stuff and just confidently do it because you learned how to in your first aid class. If you answered 1 or 2, then you need to learn how to do first aid because it's really important, and you never know when you're going to need it, and it could be like anywhere, just at school or in your home even. So it's really important to learn. So today I'm going to tell you some statistics about first aid, and I'm going to tell you a few tips about first aid and show you what you should have in your first aid kit. So first aid statistics. 59% of people do not know how to do first aid, and they're not confident about doing it. And 24% of these people would just leave the person be and wait for the ambulance to come, and that's a bad idea. It's better to try even if you don't know how, because you could end up saving a life. And how would you feel if the person like next to you was choking and they just died? That would be terrible. So, many people who die after an accident, it's just because of simple things, as I said before, and 2,500 people die just from choking and not breathing. So that's something that you can help with, you know, that's like really simple first aid. And a lot of people who could be saved is just like heart attacks and choking and being unconscious and bleeding. And those are all things that you can fix with first aid. So now I'm going to show you some tips. So how to do CPR. So if CPR is to be used if a person is choking, just kidding, if a person is not breathing, and so say that a person is not breathing, so you would lay them down, and then you would lock your arms like this and do compressions, just 5 centimeters at about 100 beats per minute. And a tip for this is sing "Another One Bites the Dust," because that's 100 beats per minute. So it'd just be "Another One Bites the Dust," yeah, because that's 100 beats per minute. And you do this 30 times, and then you pinch their nose and take 2 deep breaths into their mouth. So make sure to pinch their nose, because otherwise it just comes back out and you're not doing anything, even though you might think that you're doing it. And just keep doing this until an ambulance comes or they start breathing. And don't leave them, because otherwise they will just, yeah. So next thing is the Heimlich. The Heimlich is to be used only when a person is choking. Do not try to do it otherwise. And if a person is choking, then they will not make a sound. So if they're just sputtering, leave them alone. It's better to leave them alone. If they're not making any sounds and they're just kind of sitting there, or if they run out of the room, that means that they're most likely choking, because they want to do it in private, so they'll run out. So, and then the universal sign for choking is this, with your hands up. So if you see that, then that means they need the Heimlich. And I'm going to demonstrate it on Claire. I'm not actually going to do it because that could be harmful. I'm just going to kind of give you the general idea. So if Claire was choking, then you put your fist right here and your other hand on top, and then you thrust back and up. Really hard. Don't just thrust back and don't just thrust up. It has to be back and up really hard. So they will cough up whatever object they have. And just do it hard until the person coughs up whatever they have, and yeah. So next is bleeding. If it's just a small cut, you know, wash it out and bandage it up, and it'll be fine. If it's a bigger cut, put some gentle pressure on it, and make sure that it doesn't need stitches or anything, because if it does, then that's really important that you get stitches. If it's bleeding from an artery, it will be a lighter color, and it will be spurting blood, it won't just be running. And make sure that you give attention to this because that's really severe and it could be life-threatening. So apply hard pressure with a gauze pad, and if you don't have that, just use the palm of your hand. Apply really hard pressure. Don't attempt to clean it out. And then make sure that you bandage it, and if the blood bleeds through the bandage, don't rebandage it, just put more bandages over. The next thing I have is nosebleeds. Just pinch your nose and don't lean back because the blood could run into your stomach and stuff. And finally, shock. What causes shock? Shock happens from burns, like really severe burns, if you have an allergic reaction or after a loss of fluid, such as blood or vomit. And if you have shock, they might do things such as be dizzy, go pale, become clammy or sweaty, become unconscious, become restless and anxious, have a low blood pressure, have a weak and or slow breathing, and have a weak and fast pulse. So if they have shock, lie them down on their side, make sure that they're comfortable, and if you have a blanket, put it over because you want them to be warm. Make sure that they are on their side because if they are lying back and they start to throw up, then it won't come out and they'll just drown in their vomit, and that's really disgusting, and that would be a terrible way to die. So make sure that they're lying on their side. And finally, what you should have in a first aid kit. So you should probably have a first aid instruction book if that's possible, and then you should have scissors. Scissors can be used for lots of things. It's probably one of the best things that you have in your first aid kit. You want to have tweezers for things such as slivers, that's a nice idea, non-latex gloves, Q-tips. If you were in the dark, you'd want a flashlight, so make sure you put a flashlight in them. A thermometer is a good idea, and then like an ice pack. They're also called cold compresses, so just have one of these if you can. And then you'll want to have a breathing barrier if possible. A breathing barrier is for CPR, so you don't have to actually do the mouth-to-mouth breathing. You can just put it over, and it does everything. Well, it doesn't do the compressions, but you can just breathe into it. Yeah. So that's really nice if you have one of those. Antiseptic wipe packets. If you don't have these, probably baby wipes would work. Ointment packets. These are nice for things. And then Tylenol or aspirin. These are really good if you're in pain and stuff. Of course, you'll want to have the Band-Aids, and you'll want to have like the roll-on gauze and stuff. And then you'll just want to have some sterile gauze pads, and they just kind of look like this, just sterile. And then, so make sure that you keep things in your first aid kit updated and stuff. So like if you say that you used all the Band-Aids up, you'd want to put more in. And then try to have one in your car and places that you go. So I've now shown you some first aid statistics and tips and how to stock up a good first aid kit. And now that you know a few tips, you can go online or anywhere for information. Your local hospital will probably have classes and stuff. And this stuff you can take into class and be confident with first aid when you need it. Thanks for watching my speech.